Hi, I'm Nalisa Neuendorf. I'm the Social Science Lead here at the PNG Institute of Medical Research, and I focus on all things qualitative research. I'm going to be talking a little bit today about an upcoming research activity under the STRIVE program of research that focuses on a climate case study. This will be a focused qualitative study, small but focused, designed to fill a critical gap in understanding how climate change or a changing environment affects and impacts health here in Papua New Guinea. PNG, of course, has significant environmental and climate change impacts already in terms of rising sea levels, threatening coastlines, rising temperatures impacting health, disease, risk and vulnerability, food security issues, and a loss of suitable arable land that it impacts our sustainable farming practices. Other natural disasters risk include things like flooding, earthquakes, cyclone, and other natural disasters. So it's really vital that we're developing a evidence base of understanding around how these changes in our climate and environment are impacting our health and health outcomes. So there's a lack of solid empirical evidence currently, evidence connecting health risks directly to climate change or changing environments across the whole PNG experience. What we're going to do in this research activity is really aim to fill that gap by collecting actual stories, generating key knowledge, which is essential to crafting effective responses, especially within our current limited resource setting. Overall, in a bigger picture sense, the aim is to gather real-world evidence through understanding perceptions and knowledge from community members, from our healthcare workers, and from program managers at a national, district and local level of response. So methodologically, this study focuses on or utilises an ethnographic frame. At its core, we'll be undertaking one-on-one interviews with people within our community, within the health setting as well, health system setting as well. We'll be collecting audiovisual content, and we'll also be undertaking participant observation while in the field. Ethnographic method is really important for us here at the IMR because it's utilised across all of the qualitative work that we do, and it really requires us as the researcher, as the research tool, to make sure that we're checking our assumptions and biases, that we're reflecting and reflexive in our practice as we undertake any research activity. The audiovisual content also focuses on a participatory research approach involving our participants in the co-production of evidence and knowledge to enable them through visual anthropology and sensory ethnography, the ability to tell their own stories through whatever content and modes of expression that are best suited to them. We'll also utilise a talk story methodology in our data collection. Sanger has developed this methodology to really mirror our Melanesian research style in terms of how we develop our ways of being, knowing and doing, and being able to express those in a mode that is best for us. The really important part of the visual content or the audiovisual content is that it's a really powerful tool for conveying lived experience and the texture of social life as it relates to this particular area of research interest. All of this is framed under decolonising Indigenous frameworks for research, which means that as best as possible, our practice is to amplify the voices of our participants, to attend to some of the power dynamics that exist between the researcher and participant, and to ensure that our research is done with community, not on community. So these climate case studies will take place in Madang and Milne Bay provinces. We'll be utilising our networks through the STRIVE program, focusing on the catchment areas around key sentinel sites. And we are deliberately focusing on engaging communities that have particular cultural structures, so a patrilineal or matrilineal structure, to also look at maybe some of the gendered aspects of the impact of climate change on health outcomes, but also the decision making around community level health issues, land use issues as well, that are also impacted by climate change and the changing environment. So in a nutshell, this research activity is really focused on building a baseline understanding of how our communities actually perceive and define climate change, and how these might be connected to their health risks and vulnerabilities, especially those related to vector-borne diseases. Secondly, it's to improve our grasp of how communities are responding to climate change and mapping out some of those vulnerabilities as well, and exploring how the health program and communities, health systems and programs, as well as communities, are creating adaptation in their local experience and also responding or intervening to ensure that they attend to their health outcomes as well. So this research activity is really just it's about going beyond just identifying problems, but to try and really understand what resilience looks like, and also contribute to any future adaptation or response intervention that is appropriate and useful for a local context in PNG. The insight gained through this research also helps us to ask more questions. So it's really about how do we continue to empower our community voices through the type of research work that we do to attend to some of these types of research areas of interest, such as climate change and the impact on health. How might these kinds of work also contribute to global understanding or shift global understanding? And how does this kind of research also inform a global response, not just for health, but also across all areas of environmental change and climate change?